Traumatic spinal injury is a serious life-changing condition that can have long-term effects on a person's health and daily life. While most research focuses on physical recovery, there is growing evidence that other factors may also influence survival. One important factor is mental health. Both traumatic spinal injury and mental disorders are linked to a higher risk of early death. However, it has not been clear how these two conditions interact. This study explores a key question: how do pre-existing mental disorders affect survival after a traumatic spinal injury? Understanding this is important for improving care and identifying people who may be at greater risk. To investigate this, a population-based study was conducted in New South Wales, Australia. Hospital records of people with traumatic spinal injury were linked with ambulance, emergency department, admitted patients, and death records. Survival outcomes were then compared with those of the general population, taking into account age and mental health status. Several important findings emerged. First, about 1 in 3 people with traumatic spinal injury had a pre-existing mental disorder. This shows that mental health conditions are common in this group. Second, the risk of death was much higher among those with mental disorders. For example, people with substance use disorders had up to 9 times higher risk of death. Those with both mental illness and substance use disorders had up to 17 times higher risk. In addition, deaths from external causes, such as accidents or self-harm, were especially high in these groups. This suggests that some of these deaths may be preventable. These findings show that traumatic spinal injury is not just a physical condition. Mental health plays a critical role in recovery and survival. People with pre-existing mental disorders may face additional challenges after injury, including higher risks of complications and harm. This highlights the need for a more integrated approach to care. Rather than treating physical and mental health separately, healthcare systems should address both together from the beginning. This could include early mental health screening, coordinated support from different healthcare professionals, and targeted care for those at highest risk. In summary, mental disorders are common among people with traumatic spinal injury and are linked to a much higher risk of death. Improving outcomes will require a more holistic approach, one that supports both physical and mental health. To learn more, the full study is available in Annals of Physical and Rehabilitation Medicine. It is hoped that this research contributes to better understanding and ultimately better care for people affected by traumatic spinal injury.